Hello, my name is Steve Sammons, and today I had a chance to spend some time with Evan Hedlund. He's the assistant professor of mathematics and the director of the mathematics program here at Corban University. Today, he talked about what it means to flatten a curve and the impact as we go through this COVID-19 virus. I thought it'd be good for us to hear from our own faculty as they describe the problem.
Thank you, Steve. So I am Evan Hedlund. I'm an assistant professor of mathematics at Corban University, and I'm a program director for mathematics as well. In the last week of classes, during my differential equations class, we were able to look at some mathematical models. Specifically, we looked at an SIR model that models epidemics and the transfer of disease. And so I was able to use that time to kind of give my students some perspective about what's happening, and just to help them be able to be help in their community with communication and still some fears if there were any present. So I'll walk you through the graphs so that you can see. I'll pull those up right now. So this first graph, this is all based on a scenario where we're assuming 1,000 people for a population. We've got an assumption that it would take 3 weeks for recovery once a person is infected. And we are assuming an initial infection of just one person. So as we look at this, the first scenario is looking at a transmission rate of 5 interactions per infected person per week, sufficient for transmission. And the line that we're really wanting to focus in on is this orange one. This is the curve that you've been hearing that we want to flatten the curve. And the reason for that is simply that if this curve spikes too high, we have the potential of overwhelming health services. And so we really want to kind of flatten that curve to minimize the effect that it can have, or at least to get it in a range that doesn't overwhelm the system, that our healthcare system can handle. And so as you look through, the only thing that changes between these graphs is the number of interactions per infected person per week, sufficient for transmission. So here, if we have 5, you can see moving on to 4. Oops, let's see. Here we go. With 4, you can see that the orange curve is a little bit, the peak is a little bit less in height than before with 5. As we move down to 3, it's even more dramatic, and 2, even more pronounced. As you'll note, though, throughout this, the peak of the curve is also shifting to the right, and part of this process is by limiting the interactions, it's going to spread the infection over a longer period of time. In the first case, you see it happen rather quickly, and then it goes out. But that makes it hard on the healthcare system. By flattening this orange curve, makes it a lot nicer. Here we go with a transmission rate of 1 interaction per infected person per week. And you'll note here I also adjusted the time in week scale at the bottom. So this is over 20 weeks rather than the 10 that the previous scenarios we're looking at. And then if we drop down below 1, then you can see this, and that's even spread over 40 weeks. So basically, I wanted to use this as a way for students to become informed about the process of transmission, and ways that we can help our healthcare system out with this. We really want to limit our interactions that would be sufficient for this type of transmission, and we just want to help each other out. I was excited to see that we were at a point in the class where we could introduce this model. It's a basic model in compartmental analysis, but it does the job of illustrating the curve of infected people, and then how to think about it in terms of reducing that curve or flattening it. So I thought it was a good time, and I'm excited to help where I can in communicating here. Advice that I'd have for people would just be simply to limit your interactions, be cognizant, be mindful about the interactions that you do have. Be sure to wash your hands, as the CDC states. But we're all in this together. We're all united. So let's help each other out. And if you have questions, you can talk with me as well.
Evan, thank you so very much for coming on. Everybody appreciates your dedication, and I love the clarity and understanding more about what it means to flatten the curve.
Yeah, absolutely.
Okay, thank you.
Have a great day.